Hi, Mark Power here again, your stuttering specialist. Today's question is a good one. Is there hope for a stutterer? Is there any hope if you have a stuttering problem? And unfortunately, there's been a lot of misinformation that takes away hope from people who stutter. These days, most speech therapists are telling clients that you always will be a stutterer. And if you tell a child this, it really is taking away their hope. The reason why they've probably been telling this is that they know that they don't have the tools to fix the stuttering. So the only thing they really can do is to help the child feel better about their stuttering and learn to deal with it. They may not have the skills or an effective stuttering treatment program to resolve the stuttering problem. Basically, they haven't read the research, because modern research has shown that intensive stuttering treatment programs work. There's a study by Ingham et al. In 2015 that was published that shows that from about 10 to 12% syllable stuttered, the subjects went from that level down to 1 or 2% syllable stuttered. That's a dramatic recovery, and also it's well within the limits of normal speaking. They also found that after the treatment program was over, the subjects who stuttered went from feeling never or sometimes feeling like a normal speaker to feeling sometimes or almost always they felt like a normal speaker. And this is a big change, and it's also important for how people look at themselves after the treatment program. Another piece of that information would be my own story. When I was in my first job at a rehabilitation hospital, I had to work with stroke patients, and I stuttered severely. But during the treatment times working with the stroke patients, because they could hardly understand me and there wasn't a whole lot of threat involved, my stuttering was pretty minimal. But every Friday, we had to do a staffing. And the staffing is when you make a report of your progress during the week, just a few sentences in your notes. And each of the therapies are involved. They're spread in all around a big table, and they go one at a time to staff the patients. Now, when they got to speech therapy, I had a 30-second block trying to get a sound out. Not too good for a speech therapist when they're doing a staffing on the patient. That's how severe I was at that time in my first job. After that, a couple of years after that, I went through a treatment program that was effective for me. It was a stuttering intensive treatment program. And a few years after that, I actually was able to present a 3-hour workshop to 200 speech pathologists. And they knew I used to stutter too. So I think they were waiting for me to do that. But I didn't have any problems at all. And I ended up at the end of that 3 hours, I really enjoyed the presentation. I look forward to the next one. So hope for stuttering is there, but you need to do specific things. You need to have an intensive stuttering treatment program that's delivered by a stuttering specialist that's trained in the program to deliver it as it was intended, not just making up what you do as you go along or adding a little bit of this and a little bit of that and putting different parts of different approaches together, or asking the client how they want to work on their recovery. They haven't read the research either. They don't know what the programs are that are more effective. Also, being a person who stutters really doesn't help your recovery if you have treatment. I stuttered myself, but that really wasn't part of the treatment that I did. I needed to change the way people talked who were coming to me for therapy. It wasn't about me. So today, there is a good chance for recovery from stuttering. Here's what you need to do. You need to choose the right speech language pathologist. As I said before, someone who is a specialist in stuttering and trained in a program that works. And you need to commit the time and finances for intensive therapy in a treatment program. And this may take a lot of hours. It's learning a new skill, learning a different way of speaking. So you can't do that overnight. Like learning how to play the piano or learning how to play the clarinet. Those are good examples. You really need to spend the time in there learning the skills and also practicing to make them the way you play the piano or the way you talk. So that's why I say there is still hope for people who stutter, and I hope you benefit from these comments. Thanks a lot. Mark Power here, and if you like this video, then don't forget to like and subscribe for more helpful videos like this one. Also, be sure to hit the share button and leave us a comment below so that others can benefit from it as well. I'll be recording a lot more helpful videos like this one to help you overcome your stuttering. And if you'd like to be notified, then click on the bell icon below.